Tonight we are confirming 1,761 cases total of COVID-19 in San Antonio. That's an increase of 84 from yesterday. Of note, 54 of the 84 are inmates at the Bexar County Jail, so we have 30 from the community to report tonight. There are now 293 inmates and 49 staff positive for COVID-19, and we have the experts here to talk a little bit more about that in just a moment. We do have one more death to report tonight. That was a Hispanic male, 60 to 69 in the age category. So unfortunately, we have lost 53 of our neighbors since this public health crisis began. We do report 834 people total recovered from the virus tonight, and that is good news, along with our hospital numbers, which are still in good shape. We have 60 folks in the hospital today that are currently COVID positive, along with 27 that are awaiting test results. 34 patients are in the ICU and 21 are on ventilators, so that makes for available ventilator capacity 79% and 32% of staffed hospital beds. Before I hand it off to Judge Wolf, I do want to let you know that today the Metro Health Department, along with the San Antonio Fire Department, announced 2 new walk-up testing sites that will be at the Las Palmas Library along with Woodlawn Lake Park. They will be operating from 9 to 5 on Thursday, Friday, and Saturday. The addresses are 515 Castroville Road along with 1103 Cincinnati Avenue. Both are no cost and do not require an appointment. And again, they will be available to you from 9 to 5. For more information, including some other testing sites that will be operated by the state of Texas, you can go to the sanantonio.gov website. So let me turn it over now to Bexar County Judge Nelson Wolf.
Thanks, Mayor. And I'm delighted tonight that Sheriff Salazar is joining us and Dr. Brian Alsip is joining us. The Commissioner's Court works very closely with both of these men. The sheriff probably has one of the hardest jobs in the world running a jail. And Dr. Alsip has been instrumental in working with us when we created the opioid task force. He chaired that and was very successful in getting that under control. And then he also led the effort where we began to educate people about the hazards of drinking too many juice and cola drinks that are just jam full of sugar. So they're really great instrumental leaders, and we're delighted to have both of them here. So, Sheriff, would you like to say a few words?
Yes, sir. Thank y'all for having me on today. We'd love to talk about some of the efforts. What we're seeing right now is no doubt, I'm not telling y'all anything y'all don't already know, history in the making. Certainly a game changer for law enforcement. We're used to dealing with bad guys and bullets, and we're not used to dealing with this unseen enemy like COVID has proven to be, but certainly a worthy opponent. At the jail, we're doing a lot of mass testing, which on the surface is driving our numbers up. But I can tell you that it's taught us a bunch of interesting things. As of now, we've had about 301 inmates test positive at the Bexar County Jail. 42 of them have recovered completely. As you know, we lost one earlier in the week. One inmate passed due to COVID and other comorbidities. So at present, right now, we've got 259 positive inmates, but 222 of those are completely asymptomatic. No symptoms whatsoever. You wouldn't know it to look at them that they have COVID-19. So that's very, very interesting to me. Again, my thought on that is I think that it's part of a bigger picture, what we might see in the community. And of course, I'm here today, and I'd be okay with talking about the deaths or our ongoing numbers. We seem to be leveling off, and so I'm happy to report that. But of course, I'd love to answer whatever questions everybody might have for me later on in the broadcast.
Great. Dr. Brian.
Thank you, Judge. Again, I appreciate being here as well. We University Health System provide the medical services for the Bexar County Detention Center, and really since our first positive that we identified amongst the inmates have been having daily calls with the Sheriff's Office, with Bexar County staff, UT Health San Antonio, and University Health System to really work collaboratively to address everything around this scenario. And that's not just the testing of inmates and staff, but it's looking at systems that are in place. The jail has had to adapt just like businesses are going to adapt and hospitals adapted around screening individuals before entry. That includes staff as well as inmates. Deep cleaning and sanitization, hand hygiene, wearing masks, trying to use distancing wherever possible, even in a very challenging scenario like the jail. So it's a great collaboration that we have, but it also requires good communication and I think good data. And so that's really what we've established so far. And each time we find a new positive, we do contact tracing to make sure that it informs us as to where we can do testing next. In some ways, the jail is very much a mirror of the rest of the community, and so what we're seeing there is also reflected in our community here in San Antonio. So it takes a lot of extra work because you don't have the same kind of freedoms that you do in a household or in a community setting outside of the jail. But it's a great team effort, and a lot of folks are working on it.
Thank you, Doc, and thank you, Sheriff, who are both here to answer questions. Do want to remind folks if they want the latest on COVID-19 in the community, you can go to the website at covid19.sanantonio.gov, or you can text COSAGov to 55000. So at this point, we'll go to questions.
Hey, Mayor. Jackie Gray with KSAT. Quick question about the no-cost pop-up testing sites. How is that being paid for, and why did it take so long for free testing to become available?
So we've been increasing testing based on the task force goals, which are to get to 3,200 according to health transition teams. So we've been expanding resources. The trouble right now for us in terms of testing is not the capacity, it's driving the demand. And so a couple of things are happening. We're focusing testing sites where the health transition team saw that we needed more access. And then the other thing that's occurring right now is similar to what has been happening with the jail, congregate settings. And we have 7 of them that we're tracking, nursing home facilities and so forth, that have any positives that are in there are now going to have universal testing. So everyone in the facility will begin to get tested.
What are the other congregate settings? You said it's the jail, and then there's 6 other all nursing homes?
So let me get those for you. So we have we have a few, Advanced Rehab in Live Oak, San Antonio Behavioral Health Care Hospital, which was reported last night. All of these have been reported at one time or another. Buena Vida Nursing Home, Rio at Mission Trails. We also have Pecan Valley Nursing Home, and then we had a new one reported today at Legend Oaks West.
And should data from some of those be available now in terms of asymptomatic versus symptomatic?
So the Metro Health will be separating in the reporting asymptomatic from symptomatic. But in terms of the data in those congregate settings, all the positives that are being reported are in our numbers already.
Let me just comment real quick. The difference between the jail.
This briefing is continuing right now on KENS5.com, the KENS5 app, and the KENS5 Facebook page. Here are the latest numbers. 1,761 total cases. 834 people have recovered, and tonight, 1 new death to report. That brings the total to 53. The sheriff joined the briefing tonight saying more testing continues at the jail. In fact, 54 of 84 new cases are from the Bexar County Jail. There will be new walk-up testing sites in San Antonio, Las Palomas Library, and Woodlawn Lake Park that will be available May 7th to May 9th.